this is a summary of the products that are available for Nigeria, right? Okay, so let's move to the next slide. Let's move to the next slide. Then talk of C247. C247 is the #1 supplement that we have in our organization and is a top direct selling supplement in the whole world. It has all these wonderful benefits. All these wonderful benefits, 26,000 phytonutrients, okay? 22,000 rather, 22,000 phytonutrients locked up in each capsule of C247. How do you take C247? It is recommended for married people, okay? I hope you are hearing me clearly. It is recommended strictly for married people. Why? Because of the sexual vitality component. You can see it here, enhances sexual vitality. A lot of people have come to meet me and told me that their libido was enhanced after taking C247, okay? So if you are single, I don't advise you to take C247. You can go for the younger brother of C247, which is complete phytoenergizer. It has anti-aging and antioxidant polyphenols. So because of this anti-aging, C247 is not recommended for pregnant women or breastfeeding mothers. So you see 3 categories of people who should stay away from C247. Single people, #1. #2, breastfeeding mothers. #3, pregnant women. Because it is anti-aging. We don't know if it is going to reverse the age of the baby in the womb. And nobody carries out experiments on babies. It is prohibited by law and in medical practice. Nobody does research on pregnant women to see the effects on their fetus. It is not done anywhere. It is illegal and the person can be hung for it, okay? So because we cannot do that experiment, we say leave it out of what pregnant women can take, leave it out of what breastfeeding mothers can take, and then leave it out of what young people who are not married yet can take, okay? This is not a license to go and be overpopulating the world. Good, so let's move. Why is this C247 so special? It is made with nanotechnology. It is made with Synatech technology and Alcatech. What is Synatech? Synatech means that if you take C247 in addition to other supplements, they are not going to react together and start causing side effects for you. No. They are synergized to work together. Then Alcatech means it is made with alkaline pH. And alkaline is very, very healthy for our body fluids because diseases exist in the body when the body is in acidic state. And stress, oxidative stress, the oxidants, or the free radicals, like I talked about earlier, they cause oxidative stress and they ensure that the body stays in an acidic pH. And then disease can thrive in such an environment. But when the body is in alkaline pH, what happens is that disease cannot thrive there. So as much as possible, keep your body and body fluids and blood alkaline so that you can stay as healthy as possible. Then there's another thing you need to know. How do you take C247? You take it 30 minutes before eating, 30 minutes before eating, 30 minutes before eating, preferably in the morning. And when you want to start C247, don't start taking 2 capsules immediately. Take 1 capsule daily for 1 week. And then after taking it daily for 1 week, what do? You can now graduate to 2 daily, but maintenance dose, normal dose, you're not treating any issue or health issue whatsoever. You're just taking it to maintain optimum health. You take C247 2 capsules daily. But when you are starting, take it 1 capsule daily for 1 week only, okay? I hope that is clear. So that's how you take C247. But what if you have eaten? What if you have already eaten your food? You can take it 30 minutes after your food. You can take it 30 minutes after your food with water. Just swallow it with water. And within 15 minutes, it disintegrates in the stomach and the body can absorb it perfectly. Okay, so we talked about the youngest brother of C247, which is complete phytoenergizer. Complete is like water. It doesn't have any me. Pregnant women can take it. Young people who are not married can take it. Breastfeeding mothers can take it. It's a happy supplement for happy people everywhere, all around the world. But it has 16,000 phytonutrients and it does not have the anti-aging components that C247 has. So you understand the difference now. C247 is anti-aging. Complete does not have the anti-aging. Okay, see it here is clearly, it does not have the 5 anti-aging components which affect fetal development and growth in children. You see why we don't recommend it for breastfeeding mothers and pregnant women? I hope it's clear. And then 4 longevity polyphenols which can make pregnant women bleed. C247 is not for pregnant women or for breastfeeding mothers. I hope it is clear. But complete is for everybody. Everybody can take complete, whether they are sick, whether they are well. Anybody can take complete. Good. So complete also has the Synatech, the Alcatech, and the nanotechnology used in its production. Okay. And it has all these wonderful benefits that C247 also has. And how do you take it? The same thing. 30 minutes before breakfast or 2 hours before, 2 hours after eating. Sorry, 30 minutes before you eat or 2 hours after eating. That's how you take complete phytoenergizer, right? And maintenance dose is 2 daily. 2 daily, you are good, you are home and dry. But when you are starting, please start with 1, because it will take you a while for your body to adjust to that high level of antioxidants coming in. In fact, some people have told me that when they started taking C247, they took the two capsule daily dose, and then they started experiencing some dizziness and some funny symptoms. And I told them, oh, you need to reduce the dose first. That's too much. That's a high level of antioxidants. Your body is being heated, and your body is struggling to keep up, right? But after a while, your body will adjust to that high level of antioxidant intake, and then you are good to go, you're home and dry. So usually give 1 week interval, okay? Take it one daily for 1 week, and then you can graduate to 2 daily, and you can continue with that maintenance dose. Then we'll move on to the Kiddies 247. Kiddies 247 packed with 14 essential vitamins and minerals. So for children who are young and growing, they don't need to take C247 or complete. They can take this. This one has all those wonderful benefits infused, and it's like a gummy, meaning they remove it from their pack and they chew it. So you best take it during your breakfast and lunch for children. But I know a lot of adults in this room, they don't use their eye to see this gummies. Oh. In fact, they used to obtain it from me anytime they see it with me. I'm not going to mention names, but they know themselves. Okay, so even adults can take it. It's cool. Whether you're an adult or a child, it doesn't matter. But it is primarily for children, because you're not supposed to give those capsules to children because they are quite big and they might have a problem swallowing it, okay? But this gummy, they can chew it and still get their daily dose of multivitamins, and they stay healthy like you. Good, so let's move to Restore Life. Restore Life is a very, very powerful anti-aging agent. In fact, it reverses the damage caused by aging and toxic exposure and stress to the mitochondrion. So you see, this mitochondrion is preserved primarily when we take Restore Life. Restore Life is made from wine, but without the alcohol. And you see all these are products, they are kosher and they are halal approved. Yes, meaning Muslims can use it and Jews can use it. Okay, kosher is Jews, halal is Muslims. Okay, hope we're clear. Good. So Muslims can use it, the Jews can also use it. So that tells you how standard these products are and how safe they are for consumption. But remember, Restore Life is also for adults only. A single adult can take it. Good. But pregnant women and breastfeeding mothers cannot take it. It's not for pregnant women. It's not for breastfeeding mothers. Why? Anti-aging. I already talked about this, okay? Anti-aging. Good. So let's move. Like I said, we have a lot to cover. So if you want to screenshot, you're free to do that. But I have to move so that we can finish everything and take questions. Choleduz. Choleduz is made from omega-3 and omega-6 fatty acids and also has vitamin E. How does it work? You see this blood vessel here, right? Over time, due to aging and other circumstances, things that happen in our blood and body fluids, bad cholesterol starts to accumulate inside the blood vessel. You can think of any part of the body. All the parts of our bodies are perfused by blood vessels. There are blood vessels everywhere. The only difference is the size. So you look at your hand, these veins, they're all blood vessels. It's just that the type of blood they are carrying does not have oxygen. But within the body, you can find the arteries. The arteries carry oxygenated blood. So you have the veins, you have the arteries, and then you have the tiny capillaries that are perfusing like our fingernails, our fingertips, those extremities, right? So you see, we all have blood vessels in different parts of the body. That's why when you cut yourself, even though it's a tiny cut, you can see at least one small drop of blood. There are blood vessels that have been transversed from that injury. Good. So there are blood vessels everywhere. And now you see bad cholesterol gathering because of our diet, the kind of diets that we participate in, the kind of food we eat, high in bad cholesterol. There's good cholesterol, there's bad one. Okay, the bad ones are the ones that cause atherosclerosis. then we have the good ones, like the omega-3 fatty acids and omega-6 fatty acids and the rest. So depending on your diet, it can predispose you to the good one or the bad one. So the good thing about choleduz is that it contains the good cholesterol, and the good cholesterol can break down the bad one. Okay, the good fatty acid rather can break down the bad cholesterol. That's the beautiful part. So when you take choleduz, it starts to break off this thing, small, this bad cholesterol, breaks it off small, until the blood vessel can now be free of it and blood can flow freely. But if this thing remains like this, two things. Number one, either the blood vessel will block completely, or number two, either the blood vessel will rupture. You see, it's already changing the shape, right? The shape is already changing. So it means that this thing can burst because the normal musculature has already been tampered with. On this side, it is blocking. So when it blocks, blood does not pass through. What is heart attack? There are some small blood vessels, the coronary vessels, that supply blood to the heart muscle as it is pumping. When this bad cholesterol blocks it, blood will not enter the vessels, the muscles of the heart. The heart will stop pumping. Next thing you say, the man is complaining of chest pain. The next thing he slumped and he died. And a lot of people have died. Sudden cardiac death is what we call it. Sudden cardiac death, meaning the person just dropped and died, and usually it is from cardiac origin, meaning something that has to do with the blood and blood vessels. Good. So you see a lot of people are dying. A lot of people have hypertension. A lot of people have deep vein thrombosis. So many issues with their blood vessels. But this choleduz can help tackle all these issues coming from bad cholesterol and atherosclerosis. So it is very, very ideal. It is good for single, for married, for pregnant women, for breastfeeding mothers. It's very, very good for them. So it is an ideal prenatal and nursing supplement because it supports infant brain development and prevents baby blues. What is baby blues? Postpartum depression. You see a woman that gives birth and she's not happy about the child. In fact, it's so crazy at sometimes that they have to remove the child from where the woman is before the woman ends up killing the child. Yes, it's a mental health issue, postpartum depression, and it's quite common, but a lot of people do not know. It's only people in the hospitals who deal with pregnant women and women who are delivering that actually get to see this postpartum depression. It's a very, very real thing. So when you hear it online, don't take it like it's just one foreign thing. It is very much with us. And you'll be shocked at a lot of women who have suffered from it. But usually it progresses and it passes off with counseling, with some medication, and with support from their families. They get better. So you see, this choleduz helps prevent it. It helps the baby's brain to develop properly and supports cognitive function, eye function, reduces the risk of coronary heart disease, and everything. Okay? So hope we're clear with that. That's for choleduz. How do you take choleduz? You take it with your food, one daily, except you are treating hypercholesterolemia, meaning you have very high cholesterol, so you need a higher dose of choleduz. So look at this graph. This is like a summary of what I just said, and it shows us how to take these 3 supplements, okay? First week, you see what I talked about. You take one daily, it's okay, that should be enough. Second week, 2 daily is fine. Third week, you can increase it to 1, but usually I just stick with 2 daily and I'm okay. Because trust me, it is quite difficult to be taking drugs 3 times a day, every day. Or yes, drugs, it's difficult to take drugs. But these are products, are not drugs, they are supplements. So note the difference. Our products are not drugs, they are supplements, meaning they are used to supplement your food. It's like a food, but it is used to make your own normal diet richer and more fulfilling and better for your body to absorb and all that. Okay? So when the person is treating other illnesses, you can increase the dose. It's when there's an illness, a pre-existing illness, that the dose can be increased. But normally, just take 2 daily and you're home and dry. So we already talked about this 30 minutes before your meal or 2 hours after meal. So let's move. I talked about something earlier. I talked about cancer. Now we have other diseases that there are contraindications with our products. The normal healthy person can take C247. I already talked about it. But for people who have kidney disease, kidney failure, the person needs transplant, he's on dialysis. Listen very carefully. I'm sure a lot of us are familiar with these health issues because we might know somebody somewhere who has kidney failure, who is on dialysis, who is on admission, the body is swollen everywhere, and then the doctors are saying it's the kidneys that are having problem, or you know somebody that has a liver problem, the stomach swollen, liver cancer, liver cirrhosis, fatty liver, all kinds of things. So any issues that have to do with the kidneys and the liver, you have to be careful. The safest product to use for such people is complete. Okay, so you understand it now. That's why I said you should bring out your book and paper, because there are some things that are not on this slide that I'm going to say, okay? And when I say them, you note them down after snapping the slide. Good. What other disease do we need to be careful with? Goiter, and then autoimmune disease. Autoimmune disease like rheumatoid arthritis, like systemic lupus, like Sjogren's syndrome, blah, blah, blah. That one that that tennis star has. There's this long tennis lady that has this autoimmune disease that she has to deal with. I don't know how many of us are familiar with it, but for those who are in the sports world, they should know, they should have known about it, they should have heard about it. Okay, so autoimmune disease means that your body sees its own cells as an enemy and starts fighting itself. That's what autoimmune means, meaning your body is creating immunity against itself. So you can imagine that kind of state. It's a very, very terrible state to be in. It's not something anybody wishes for anybody. So in such cases, goiter, autoimmune disease, liver disease, kidney disease, please only complete phytoenergizer is safe. Don't give any other thing. Okay, so let's move. Next slide. Special precautions with Restore Life. I already mentioned them earlier, but this is like a summary. Remember what I said, right? Cancer of the female reproductive system. Stay away from all these supplements and give only complete phytoenergizer. I hope we're clear. Stay away from these ones. Give only complete phytoenergizer. For people who are on these medications, aspirin, heparin, warfarin, coumadin, clopidogrel, some people in this meeting will be familiar with these drugs, both healthcare personnel and also people who are actually on these drugs. If you are seeing these drugs, you know them, you've heard them, please stay away from these three. Take only complete phytoenergizer, okay? Then pregnant, breastfeeding mothers, pregnant women, stay away from these three, take only complete. Then for those who are hemophiliacs, there's something we call hemophiliac, meaning somebody has small injury and continues to bleed and bleed and bleed. The place does not form clot as fast as possible. Okay, such people do not give any of our supplements other than complete. So you see, complete is like water, you don't get enemy. It's for everybody, okay? You don't get enemy. Then what is recommended for pregnant and lactating mothers? Lactating mothers mean a woman who is breastfeeding. Complete is good, is great. My choco is also very good. Why? Contains DHA, which is part of the formative substrates for the central nervous system. Very, very important for children and for even elderly people. And then choleduz. So you see, they can take choleduz, they can take my choco, they can take complete. We're trying to cover as much as possible so that we can finish everything. Yes, Vitamax. Vitamax is a very, very, very interesting supplement. It works as quickly as within 1.5 hours, meaning within 1 hour, 30 minutes of taking Vitamax, it hits your blood circulation and continues to work for up to what? 12 hours, and then lowers risk of heart disease, supports healthy blood circulation. It helps to control your sugar level, helps to detoxify, lowers the risk of cancer and osteoporosis, helps in weight loss, lowers the risk of asthma and other lung disorders. Why? It has something to do with the smooth muscle of blood vessels and other organs. So wherever there's a smooth muscle involved, Vitamax helps. Vitamax helps to restore the normal function of blood vessels and other smooth muscle organs or tissues in the body. So it's not only recommended for people who have hypertension, okay? It is also recommended for people that have injuries, like injuries in their lower leg or injuries in their hand. You know, when there is an injury, the place gets swollen, right? And then there's a lot of inflammatory substrates that are sent there to take care of whatever bleeding is going on, to ensure that hemostasis is maintained, Okay, so somebody gets injured, there's swelling, the leg is paining the person. What can you do for the person? Give the person Vidamax. They will get better faster because the area is going to heal faster. Blood flow to that area will be restored faster, and then nutrients and substrates that are needed to promote healing will be sent there faster, and then the swelling will reduce faster, and the person will heal much faster. So it's not only for those that have high blood pressure issues. It's also very, 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 very good for people with injuries, maybe from road traffic accident, or somebody sprained their ankle, or motor hit somebody's leg, or keke. Okay, but I don't think anybody here is affected by that. But we might know somebody somewhere who is affected by these issues. Good. So in that case, you can recommend Vidamax for them. So it's not only when the person has high blood pressure that you recommend Vidamax. And how do you take it? 30 minutes before your meal or 2 hours after. And it's just taking one daily. One daily is enough. Okay? You take one daily, and that should cover for whatever you need to do. Then Burn Slim. Burn Slim means body under right nutrition. Body under right nutrition. Body under right nutrition. Burn. So that's where the BURN came from. It is made from Garcinia cambogia. It's one of the superfoods in the world, and it is highly recommended for weight loss. Why is it highly recommended? In typical supplements used for weight loss, they act on your brain to reduce your hunger signals. I hope you heard me clearly. Typical weight loss supplements we have out there, they have an effect on your brain. And how do they act on your brain? To reduce your hunger signals being sent to the stomach, so the person can stay longer without eating. And when something affects the brain, there are other terrible side effects that it comes with, because the central nervous system is controlling everything about that human being, psychologically, physically, every way possible. It all starts from here. Sickness, from here, that's where it starts from. Wellness starts from here. Emotional issues, it all starts from here. So when you are taking a supplement that is affecting your brain, you are going to experience all kinds of side effects, all kinds that you may not like. And these side effects are not just limited to your emotions. They will also affect other organs in your body, because your brain is controlling the function of everything. So you see, that's why a lot of doctors do not recommend weight loss supplements that are centrally acting. When we say centrally acting, meaning central, starting from here, starting from your brain and spinal cord, centrally. They recommend locally acting supplements that help in weight loss. Locally acting means that it will go to where the problem is and work there. It's not going to start from the brain to work. Okay? So that's what Garcinia cambogia does. It works in the GIT, the gastrointestinal tract, where food is being metabolized. So it will not affect your brain, it's not affect your mood, it's not going to affect your kidneys, your liver, and rest. It will just work only in your stomach and your small intestine and your large intestine. So its work is very, very localized, and that makes it a very beautiful supplement for weight loss. Meaning that when you eat and you take Burn Slim along with your diet, what happens is that it will work on the food you ate, and it will work on your small intestine that is involved in absorption. So what happens is that fat will be prevented from being stored in your body. It will boost your metabolism, and it will suppress your appetite from your stomach, not from your brain. And then it lowers insulin resistance, lowers cholesterol and triglycerides, because your body is not going to absorb all that fat anymore. It will enhance your energy level, improves your digestion, and then gastric issues are dealt with. It also helps to reduce stomach acidity because it's alkaline. So you see, it's a beautiful supplement. And how often do you take the supplement? You take it as often as you eat. If you eat 5 times a day, you take it 5 times. If you eat 2 times a day, you take it 2 times. If you eat once a day, take it once. Because people are always asking, what is the dose of Burn Slim? So depending on how many times you put food in your mouth, and food includes snacks, so it includes ice cream, it includes buns, it includes egg roll, it includes meat pie, all these things you are eating in between your food. you must carry your bone slim with you and be taking it as you are swallowing. Anything you are swallowing that is not water, carry bone slim and swallow along with it. Okay, so you take it to your food and then it acts during digestion. Hope that's clear. So that's for bone slim. So it makes it a very, very powerful weight loss supplement when it's taken consistently. You take it consistently and then you start seeing the effects after 3 months. So if you are planning to lose weight, give yourself 6 months using the bone slim, and then you introduce some light physical activity, meaning you can take walks 30 minutes daily, walk around your estate, for 30 minutes while you are taking the bone slim. And in 3 months, your weight loss is going to be very, very obvious. Your weight is going to drop and you have better eating habits because your appetite will also be suppressed. You have better energy levels. You are less tired. Then people used to ask me this question. I'm a breastfeeding mother. I want to lose all the weight from the pregnancy and all. Can I take bone slim? No. Read my mouth. If you are breastfeeding, no. If you are pregnant, no. Please don't go and ask me for caveats or for a way to walk around it. Don't take it when you're breastfeeding or when you're pregnant, please. When you are finished breastfeeding, you've weaned the child at 6 months, you can start taking it, okay? So that's it for bone slim. I took my time to explain because for women especially, it's very, 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 very important supplement. Good. These ones are now available now. That's feminine wash, masculine wash, and our toothpaste, okay? So I'm going to talk about the toothpaste. Some of us have it. Some of us are signed up with 44888 pack. Some of us have it, but it's not in this new recent packs, okay? The beautiful thing about this toothpaste is that it does not contain fluoride like other toothpaste. And then it also contains complete phytoenergizer. So all those wonderful supplements that are incomplete, you find it in this toothpaste. It's infused. So if your children use this toothpaste and they swallow it, no problem. They are okay. They are good to go. If you say I swallow it because you think it's sweet, no problem. It's made from honey, not sugar, okay? Also has aloe vera and then betel extract and myrrh extract that has antiseptic properties, helps to treat swollen gums and everything, okay? So that's it for toothpaste, right? It also contains tea tree oil. So all the constituents in this toothpaste are 100% from plants, 100% natural. No synthetic substance was used in making it. So let's move to my choco. My choco, I already spoke about it earlier when I was talking about pregnant women. I said it's a very, very good drink for pregnant women, for children, and for the elderly. For pregnant women, why? Because it helps the brain of the child to develop. Then for the elderly, it helps to prevent memory loss and age and the degenerative disease of the brain that are associated with aging. Why? DHA is found in the lining protecting the brain and spinal cord. In fact, it is made from DHA. The lining protecting the brain and spinal cord is made from DHA. So when there is inadequate DHA, what happens? There will be brain damage, there will be spinal cord damage, and then the person starts experiencing all kinds of craziness. You have your phone in your hand and you're using the phone touchlight to look for the phone. And you say it's old age. Don't worry, start taking my choco and you stop experiencing such things. Okay? So you take one daily. Please, my choco already has sugar. It's a chocolate drink. So just pour it into your cup, mix it with cold water or mix it with hot water. Don't go and take it 3 times a day. Once a day is enough, please. Okay? Once a day is enough. Before we start dealing with obesity. Okay, so these are the coffee drinks. We have 4 flavors. We have latte. Latte has more milk or more cream. We have original. Original is equal parts cream, equal parts the coffee. And then we have the cappuccino. It has a higher level of coffee to cream. But the men love this cappuccino. Why? They said it helps to boost their libido. So if you go to a warehouse to buy coffee, the first coffee that used to finish is cappuccino. And you will see one man with like 10 cartons. You just come and order it. I've noticed that guy a lot in Abuja RC, but I'm not going to mention his name. I'm not going to mention his name. He will just come and order all the cappuccino. And the next thing you come and tell you want cappuccino, they'll tell you cappuccino has finished. There's only latte and original left. Okay? So for men, they say it enhances sexual libido, their libido. I'm not a man, so I cannot say. So you can ask the man around you whether it's true or your husband. But for that reason, the thing moves market a lot. The thing used to finish sharp. Okay? So These are different constituents. But the beautiful thing about this coffee is that it is alkaline. It is alkaline. Okay, it is alkaline, meaning it helps to boost lowering the pH, increasing the pH of our blood and body fluids. It will help people that have ulcer a lot. So if you have issues with ulcer, peptic ulcer disease, and you'll be fighting it since, use our coffee. Use our coffee. Also, the mychoco is also alkaline, so it's very, very good for people with ulcer. Okay, then also C247 is also very good for people with ulcer. Then for diabetics, you have been diagnosed with diabetes 5 years ago, 10 years ago, last year, okay? The coffee you should take is sugar-free. The carton is black in color, and there's a sweetener inside the sugar-free that is not sugar. That is why it is called sugar-free. The sweetener is called stevia. Stevia, right? Stevia has a higher concentration of sweetness than sugar, but they are not the same molecular structure, so it does not have the deleterious effects that sugar has on the body. So if you notice, a lot of people have been using sweeteners that are not sugar nowadays. So you might just walk into a big supermarket like ShopRite and you will find stevia there in a powder, a white powder. You might just opt for it and say, I don't want normal sugar, I want to be using stevia. I think it's about 5,000 times sweeter. So you need a very, very small concentration to produce sweetness. And the beautiful thing is about stevia is that it's 100% from plants, it's very healthy, and it doesn't have terrible cancer effects like saccharin. Saccharin is very, very bad. A lot of people use saccharin. If you're using saccharin, please stop it. If you're using saccharin or aspartame as a sweetener, stop it, please. Those things are carcinogens. They are carcinogenic. They can predispose people to cancer. If you find stevia, beautiful, use stevia. Stevia is very, very healthy. It's from plants, but it's a bit more expensive than normal sugar. Of course, it has better uses and better functions than sugar, okay? So if you have diabetes, you should not be using any of our products that have sugar because it will, of course, predispose the person to a diabetic crisis. You can use our sugar-free coffee. So everybody's covered, everybody's home and dry. Then muscle pain, joint pain. What can you use? Care leaf thermal relief patch. It contains all these wonderful things: nano diamonds, germanium, grapeseed oil, silver ions, turmeric, Korean ginseng, vitamin E, capsaicin from pepper, and then St. John's wort, which is an anti-inflammatory herbal remedy. Okay, so what you do is that you bring it out of the packet. The packet contains eight pieces. Each of the pieces is like a plaster. Just bring it out and plaster it to the place where you are feeling pain. Might be your hand, might be your neck, might be your back, your waist, or your leg, wherever there is swelling and pain, right? Muscular pain. Apply it there and leave it. You can carry on with your daily activities. Within 1 hour, you will start to feel the effects because your skin, due to the heat, will absorb all these nutrients and all these things inside the plaster. And then as your skin absorbs it, what happens is that they start going to the areas where there is inflammation and where there is pain and start taking care of it. So you can use it for up to 48 hours. You can use a plaster for up to 48 hours. You can bathe with it if you want, but water might reduce the plastering effect to your skin. So you can decide to remove it, bathe, and then apply it back, okay? But it can be used for up to 48 hours, each patch. And each of these packs contain 8 patches. So you apply it as a plaster, leave it there. Your body absorbs all those nutrients there. And then you can get relief from pain. Pain. Don't come and say you want to use your external muscles. It's not from your skeletal system. Okay, menstrual pain is from the uterus, from the contraction of the uterus to let out the blood that was not used. Okay, so this is not for menstrual pain because some people have come to ask me that question. Okay, hope it's clear. If you're having menstrual pain, then you should be using C247 or complete. It's very, very, very powerful for people who have dysmenorrhea. Okay, a lot of our partners have testified to it. Those that use C247 complete, they usually don't have dysmenorrhea anymore. Yes, so if you're having that issue, very painful menstrual period, you should be using C247 and complete rather every single day. Every single day. Trust me, within 2 months, you will notice that you're no longer having that bad menstrual pain anymore. It will just go naturally. Okay. So we're almost rounding up. Our pendant, energy pendants like what I'm wearing. And then we have the energy diffuser, the eye protect. And then there's a new product that the company just released into the market. It is called the bracelet. So this is going to be in some of our new packs, the Technoverse, the Digiverse, and the Megaverse. I think the Neoverse has one. Let me see the picture of the packs. Hopefully, if there's enough time, I'll be able to share the pictures of the packs here. Yes, it's in the Megaverse pack, the Digiverse pack. Technoverse also has it, okay? So Technoverse, Megaverse, and Digiverse, they all have this bracelet. So it's like jewelry, but it has the same function as this pendant you're seeing me wear. So for the ladies and the men amongst us that like bling bling, this is a good reason to get your own Digiverse pack or Technoverse pack or Megaverse pack, right? This is going to be part of the products you receive. This bracelet, so you wear it on your hand. It has the same function as the pendant. And what is the function? It lowers down the impact of harmful electromagnetic radiation. So it is serving two purposes for you. It is serving a purpose of jewelry, but a more important purpose of protecting you from radiation. Radiation from our phones, radiation from laptops, radiation from all electronic devices. All electronic devices give off radiation. And this radiation is very, very harmful to the cell because it affects the mitochondrion, okay? Reduces the power of the cell, reduces the energy level of the cell. The person feels tired and starts having what we call radiation sickness. A lot of people are suffering from this, but they are not even aware. They're always feeling stressed and tired, but they don't even know that the exposures to devices all around them is what is predisposing them to all those deleterious health effects. And on the long run, this electromagnetic radiation leads to cancer, especially in children. It is even worse for children. So when I see parents that buy phones for their children without putting this, I hope you can see this. This is what the diffuser is. It's the same function as this pendant, okay? This diffuser. You're supposed to attach it to all your mobile devices, all electronic devices, your TV, your microwave, your AC, your refrigerator, your laptop, your phone. You're supposed to have at least one on them because it will diffuse the radiation away from your body when it is attached, okay? It reduces the radiation to up to 0. So it's a very, very, very important product. You should have it. Everybody should have it. If you don't have it in your pack, you can request for it and order it. And once it's available, it's made available to you, okay? Very, very important product. So a lot of people are suffering from radiation sickness, but they are not even aware because the symptoms are non-specific. They look like malaria symptoms. You're always tired, headache, dizziness, mood changes, mood swings. And you're wondering, but I just finished treating malaria. Well, we need to check the level of radiation hitting your cells from people's phones who are around you, from your TV, from your laptop that you work with all day at the office. That air condition, that microwave that used to stand in front and you're looking at the microwave as the food is warming. Please stop it, oh. It's not nice. You can leave the microwave and go away. When the food is finished, you time it, you can come back and collect your food, okay? So it's very, very, very important. In fact, use your gas to warm the food better. It's better, it's healthier for you than the microwave. The microwave does it fast, but the damage it does to our health is more. So on the long run, it's not worth it. You shouldn't be using microwaves for long-term heating of food. It should be very, very short and sharp, okay? So you can see some of our past presidents wearing their pendants here. Why? They understand the importance of protecting themselves from radiation. And inside the pendant, there is something inside. I'm going to open my own. You can open it. You see, there's a white patch inside. This white patch is called Eye Protect. I got it out from this green sachet here, okay? And this Eye Protect releases chlorine dioxide fumes. Chlorine dioxide is a disinfectant. It's a disinfectant. So I'm wearing the necklace protecting me from radiation. And then these fumes that are being released, chlorine dioxide, are destroying bacteria, viruses, fungi that are in the air that I breathe. So even though I'm sitting down with somebody with tuberculosis close to me and the person coughs, what will happen? The fumes will disintegrate the bacteria in the air and destroy it. So I'm good to go. In fact, when I was doing my research amongst tuberculosis patients in Ghana, this was what I wore throughout. I was wearing this pendant throughout. I was not even using face masks because then we didn't have coronavirus. And it is seen as discrimination for you to be talking to a TB patient and you are masked up because the person is already on drugs, but you are doing research and you are talking with them, talking about disease, their medication, or so you can't wear a face mask then, and you have to do the research. You have to interview these people. So this is what I wore throughout. I didn't have any issues whatsoever. I finished my research, submitted my dissertation. I'm good, home and dry. So these things work. They work a lot. She's a connector. You can read her testimony right here. She talked about how her dad had enlarged prostate and had very high PSA value. But the man started taking Restore Life, C247 and Coledus combination. And guess what? Today, his PSA has dropped to 3.2, which is very, very low and very, very healthy. It has dropped. His high blood pressure has improved. His blood pressure has improved. The mom was affected by diabetes that affected her eyes, diabetic retinopathy. And today, the woman can see well after even having both surgeries or four surgeries on each eye, meaning 8 surgeries in all, but it still did not work. The surgeries was not able to reverse the retinopathy, but our supplements were able to help her. Now, this woman can see better and she can now move around by herself, unlike before when she has to be held by the hand and move from one place to the other. So if you have these products in your house and you are just looking at the products looking at you, anya. I don't understand what your plan is. So do you want the products to expire? No, now. Then I have a personal testimony to share about this product. I have to close her name, please, for privacy and security reasons, okay? I had to close her name. I had to close her name for certain reasons. I signed her up last year, and the reason why she signed up was the product. She had been married for over 5 years and no child yet, and she was diagnosed with hormonal imbalance. Okay, she had hormonal imbalance, and she was placed on treatment for the hormonal imbalance, but the treatment was not really improving anything. Things were just the same way. So the doctors told her that the only other option they have is for her to go for IVF. IVF works. There's nothing wrong with it. It works, but it is very expensive and the failure rate is high. So if you are doing IVF, you just keep like 5 million naira in one place that you will spend on the IVF. And it may or may not be positive at the end. It may or may not work. And it takes time. It's a very painstaking process. You have to go through one series to the next series, to the next series, to the next series, okay? So it is quite emotional and painstaking for a lot of people. So when they think of the stress involved and the money involved, they're like, no, I cannot, okay? Not everybody has access to 5 billion naira that they can use for a procedure that may not work. Okay, that's the thing with IVF. It's not that it doesn't work, it works, but you have to be patient and you have to do it over and over again to get the best results, okay? So she couldn't afford it to go for IVF. So when I invited her for one of our Amazon projects, she saw the opportunity, it made sense to her. But the thing that piqued her interest was not even the opportunity, it was the product. She saw some of the products. Barrister MM showed some of the products during that presentation that time. And she decided that she wanted to do the business. She signed up. In fact, she usually buys products regularly. She's always sending money. Okay, send me this product. So I did like a training for her and taught her how to use the products because she told me about her condition. She confided in me. So I told her she should use C247 and Restore Life. C247 and Restore Life. Because C247 helps to balance her hormones, especially in women. Women that have hormonal imbalance, C247 helps them a lot. I told us why. It has phytoestrogen and everything. So it corrects whatever deficiencies there are. So she started using C247 and Restore Life. Her husband was also using it. So guess what? She started using it around January last year. And you know the good news? She gave birth last month. Yes. So somebody who the doctors had told that the drugs will not work. Oh, let's just do IVF. That's the only way you can have children. Okay. So don't worry. Let me unmute everybody. Okay, yes, the chat room is open now. You can start posting your questions. Thank God we're not distracted by plenty chats during the meeting. Okay, so she used it and today she has a baby. She just gave birth to a baby girl last month. And I started her up. When I found out that she had given birth, I was excited for her. I said, babe, how far now? How far with the, if you notice what I said here, I said, how far with that C247 now? How was it? She said, we're using it together with other supplements. All of them brought about the good news. I was like, wow, thank you, Jesus. When I was told that IVF was the last option, and she got pregnant after using it like I prescribed. She said, I continued with all the supplements plus the ones I was taking too. I asked her, how many years were you married before you took in? She said, 6 years. And today she has a baby. She didn't have to spend all that money on IVF and everything. Okay? So our supplements work. But you have to understand how they work and you have to apply them very well. I'm just going to take the first 5 or 6 questions so that we'll be done. We'll wrap it up with what we have to do tonight. If you missed any part of this session, maybe network knocked you out or something, what you can do is this. You can go back to our YouTube channel and then you'll find the training there. So you can listen to it over and over and over and over again. And I'm also excited for her because the one thing she has wanted for so many years has finally become a reality. And our products are there for her to thank for that. So freedom. During our 381 retreat, you saw that lady, right? That had a spinal problem. In fact, she was supposed to go for surgery. And she started using C247, started using Restore Life. And what happened? She came to the retreat with heels. She was wearing 6-inch heels to climb the stage. No pain, nothing. So our supplements really, really, really work. They work. Oh, you must use them correctly. So let me see what questions we have here in the chat room. How many questions can I take? Let me take just a few questions.